Hey folks, Dr. Jeff Williams with Creekstone Integrated Care here, right here in Amarillo, Texas. And I wanted to take a minute to share with you some research I stumbled across recently that I thought was useful for folks that have been in car wrecks or for those that commonly deal with these kinds of cases. I've been treating Amarillo Whiplash patients literally for years now here at Amarillo Pain and Accident Chiropractic Clinic. At this point, I'd guess that I'm probably as close to a whiplash specialist as anyone else is in this area. In fact, I was even acknowledged in the 47th District Court just this month, January 2016, as a whiplash specialist during testimony in a car wreck case. Speaking of car wreck cases, there's no doubt that insurance companies and insurance adjusters, third-party adjusters, they tend to use several tactics to discount what they're going to pay to a patient when settling a car wreck case, especially in our area of the country. There are lots of determining factors, from the medical records, to the year of the car, to the lost wages, to the direction of impact, to the treating doctor type, to the attorney of the victim, if the victim happens to have an attorney, to the region of the country and what the average payouts are in that region, etc., etc., etc. It goes on and on. What these insurance companies usually don't take into account are the risk factors that are present in these cases. Wouldn't you agree that there are certain things that can predispose a whiplash patient to a more severe injury? If you said yes, well, you'd be correct. And should the patient be punished by the other driver's insurance if they just happen to have some of these risk factors present when another driver crashes into them? I would argue that the answer to that question is no, they don't deserve to be punished. In fact, there's a ton of research showing that certain risk factors can most certainly make a whiplash injury worse. So much research, the argument to the contrary is actually kind of silly at this point. Here's a list of some of the risk factors for acute injury following a motor vehicle accident. If the occupant is a female, females get hurt more often. Being a female weighing less than 130 pounds. Having a history of neck injury. Having the head restraint positioned below the head center of gravity. Having a history of a cervical acceleration-deceleration injury or history of whiplash. Having poor head restraint geometry, as it commonly happens with tall patients. Being in a rear impact versus being in other vector impacts. The use of seat belts and shoulder harnesses. Having a smaller body mass index, such as females or very small framed males. Being an out of position occupant. So say they're leaning forward or slumped over, something of that nature. Non-failure of the seat back. Having the head turned at impact. Being unaware of the impending impact. Being of increasing age, middle age and beyond. Being in the front seat position versus being in the rear seat position. Being impacted by a vehicle of greater mass, a bigger vehicle hitting you. Being involved in a crash with a speed under 10 miles an hour. It's true. Being a rear struck occupant when the vehicle that hits you has a motor that is longitudinally mounted. Things you didn't even think of. Being the driver versus being the front seat passenger. Those are all risk factors for acute injury. Now here's a list of some risk factors for chronic or late whiplash following a motor vehicle accident. So, being a female again, being in a rear impact versus other vectors, having a smaller body mass index in females, experiencing immediate or early onset of the symptoms, and or more severe initial symptoms, experiencing initial back pain, experiencing initial decreased cervical spine range of motion in females only, experiencing initial upper back pain, experiencing initial upper extremity numbness or weakness, experiencing initial upper extremity pain, experiencing greater subjective cognitive impairment, things like forgetfulness, experiencing a greater number of initial symptoms, experiencing greater severity or frequency of initial symptoms, experiencing high initial pain intensity, the use of seat belt, shoulder harness in the case of low back pain or neck pain, having initial physical findings of limited range of motion, experiencing neck pain on palpation, experiencing muscle pain following the crash, experiencing disturbed vision, initial sleep disturbance or fatigue, initial neurological symptoms, radiating pain in the upper extremities, for example, having a past history of neck pain, ligament laxity, having a past history of headache or currently suffering headaches, evidence of initial degenerative changes seen on radiographs, evidence of foraminal stenosis on the radiographs, or loss of or reversal of the cervical curve on radiographs, being of middle age and beyond, being in the front seat position, being in the driver's seat versus the passenger seat for the females, being an occupant of a vehicle manufactured in the late 80s to the early 90s, believe it or not. This is relevant for rear impact crashes only. Experiencing initial generalized sensory hyperalgesia, having the head rotated at impact, both frontal and rear impact crashes, being unaware of the impending impact. Can you believe all that? So those were all, that last set were all risk factors for late or chronic whiplash. Now, all of these have a lot of research backing them up. Research that I'd be happy to provide for you upon request, particularly for the low-speed rear impact crashes, or LOSRIC. This is something that every single narrative report that comes out of our office speaks about and highlights when it's present in the particular case. One can't simply look at the damage of a vehicle and try to correlate it to the severity of injury. This is something I will blog about at another time, but you have to take into account the risk factors and/or the severity of the risk factors present when determining the long-term prognosis. Now, here's some research that explores this just a little bit more. Now, why they did it, they wanted to figure out what risk factors people had that caused chronic disability following whiplash injuries. They wanted to attempt to understand the impact of those risk factors. And here's how they did it. Reports were collected approximately 32 days after the traumatic injury, and then again a full 12 months later. There were baseline measurements collected in regards to disability, neck movement, range of motion, pain, psychological and behavioral indicators, as well as chronic disability at the 12-month mark. The main way to measure outcomes was done through the use of the Neck Disability Index Questionnaire, which we use regularly here in our office. And here's what they found. Psychological and behavioral factors were important factors when considering chronic disability following a whiplash injury. The amount of risk factors involved in the incident is important when evaluating patients and their likely outcomes following whiplash. So, risk factors are a pretty big deal when deciding our whiplash categorization for each patient. The severity of the injury, the treatment protocol, and the long-term prognosis of the patient's recovery process. Please call our office at 806-355-3000 if you have any questions about car wrecks or risk factors. I'd be glad to talk with you in between patients. That's what we do. We've been doing it for years. So again, thank you for watching. I'm Dr. Jeff Williams with Creekstone Integrated Care and Amarillo Pain and Accident Chiropractic Clinic right here in Amarillo, Texas.